Advanced ENT and Allergy. Now, you've heard that name, very respected in the community. They're doing something a little bit different, and that's why I wanted to talk to Dr. Aaron Smith, who is a face and neck and head surgeon. Exactly. Is that right?
Yeah.
Is it plastic surgeon? Is it okay to call you that?
Yes,
I'm not sure, doctor. I want to make sure I get this right.
Yeah.
Okay. Before we get into the procedures that you offer here, what you're doing is different.
Yes.
So when we say plastic surgeon, a lot of people think, okay, we're going to talk a lot about, trying to look younger and stuff, but what you specialize in is different, doctor. Tell me about it.
So it's mainly reconstructive in nature. People that come in for issues with facial paralysis, a large keloid on the ear, or have a skin cancer. Those are very common things that we see. And then on the face, obviously, it's a very prominent feature that we all have and want to preserve, and that's what we try to do.
So these are reconstructive services. I would think for you, and this may be why that was your aim and your point of focus, is you're changing people's lives for the better, and you're good at it. And you're good at it, my man. See, I love the confidence, because I know this to be true because I'm looking at your resume and I can fill a book. It's very impressive. Tell folks just a little bit. I know you're a humble guy, but a little overview of your medical schooling.
So I went to medical school here in Louisville, matched in a place that I wasn't quite prepared to go to, Memphis, Tennessee. But you go where you match, and I fully believe that where you match is where you're supposed to be. So in Memphis, they happen to have a pretty strong facial plastic surgery portion of training. So I was exposed to lots of trauma, lots of skin cancers. In that program, they did cleft surgery, which is different than a lot of places. And my mentor, Dr. Langston, did cosmetic surgery. And so, having that full package of all these different experiences kind of led me to where I was. And I decided to do a fellowship there in Memphis. And I was fortunate to be able to kind of design my own fellowship to a little extent, where I worked with this really phenomenal oculoplastic surgeon, so lots of eyelid surgery, the cosmetic aspects, and then all the reconstructive stuff still.
Okay, so I ask you this, so why advanced ENT and allergy? To me, what are the advantages of going to a surgeon at a place established like advanced ENT and allergy?
So it is confusing for patients sometimes, because they're like, well, why is my dermatologist or whoever sending me to advanced ENT to see you? Well, there's a lot of different avenues to get to plastic surgery. So you can go through ophthalmology, you can go through general surgery, you can just do plastic surgery. So with all these different ways that you're trained, you kind of take your own, or bring your own take on it. Okay, so through ENT, we only work here, and so in the plastic surgery realm, we're really good up here. It's 1/5 of our board certification is in facial plastic surgery, which people don't usually know.
So what kind of surgeries and procedures do you do most often, Dr. Smith?
A lot of it is the skin cancer reconstruction. The vast majority of what I do is that, and that kind of goes with scar revision too, and the large keloids that come into us. The kind of offshoot of that a little bit.
We're going to take a look here. Okay, so what are we looking at here, Doc?
This is a wonderful lady that came to me with a large left earlobe keloid from a piercing. And this photo is about 2 months later, after we had removed it and reconstructed her ear.
That's beautiful work.
I'm happy with it, and she is too.
I bet. Well, yeah, that's right. It's important. If you're happy and she's happy, I think you did your job. That's a win-win. Okay, the next one now. I'm going to give you a little bit of a disclaimer here. This is a little bit graphic, but I think it's important to show because a lot of people have been through this. Okay, so this is a MOHS surgery.
Sure.
You're going to take a look at here. And so what is that an acronym for, MOHS?
Well, so it's Frederick Mose is the person who developed it in Wisconsin, and it's a dermatology technique where my friends in dermatology, there's several around town who are fantastic people. They do really wonderful work. And they come with these circular defects because they're looking at all the edges of that cancer. And so they're going to follow it to wherever it goes. And sometimes you don't know how big it's going to be or in a sensitive location. And so that's when they asked me to help. Okay, so this would be post-surgery. Yeah. So someone who comes to you who says, okay, I just had my dermatologist take this off of me. I don't like the look of it, correct? Sometimes. So a lot of the times is we're coordinating together. Okay. So the Mohs surgeon's already like, hey, this could be really big, or I don't like that it's, you know, on the eyelid. Can you reconstruct it?
So we saw 2 examples of the surgeries that you performed, Dr. Smith. Other procedures. There may be folks out here who go, I think he's for me. What other procedures do you perform? What other surgeries?
So we also do a lot of nasal surgery and ENT. So there's a lot of people who've had septoplasties out there and still have some issues breathing through the nose. There are some non-invasive minimally invasive techniques we do in the office to correct some of the nasal wall collapse, but there's also surgery for that, which I do a lot of that as well.
You know, I would think it'd be rewarding when you work on children who,
I do.
because children can be insensitive, not on purpose. They're growing up, they don't know, and they tend to exclude kids, perhaps even bully kids who look differently. That has to be rewarding to change a child's life.
I agree with you. It's fantastic. It's one of the most rewarding things.
See, I see you smiling there. That's good, isn't it? Yes. You know what? Of course, we see a lot of cleft palates and that kind of thing.
Right.
When you change the way a child looks and they look at that mirror for the first time and are proud of what they see, man, I can't imagine how good that feels.
It's pretty remarkable.
Was it worth the cost of medical school? That's a big question there.
Yeah,
yes, okay.
I think so. Yeah.
Okay. Dr. Aaron Smith, you're fantastic. So for folks who are watching now and say, you know what, I have a loved one or perhaps I have an issue that I'd like you to take care of, how do they set up an appointment? How does it work?
They just have to call the office.
That's it?
Yeah, they just call.
All right. Is there a consult? Is there a consultation first? You take a look-see, maybe tell them what their expectation should be, that kind of thing?
Yeah. As you can imagine, some of the things that I do are pretty crazy and sound graphic, right? I mean, when I'm explaining some of these surgeries.
It's medical, yeah.
So we definitely want to talk about those things first so they know at least a little bit what to expect. Maybe not everything, but at least a little bit of what to expect.
All right. Dr. Aaron Smith, Advanced ENT and Allergy. Thank you so much for your time. I know you're busy.
No problem.
I bet do you have a little pager still? Do they still carry those doctors? I bet that thing's going off like crazy.
Well, cell phones do a lot of things.
Okay, cell phones. All right. See? Old school right here. New school right there. Okay, Advanced ENT and Allergy. We'll take a little break and we shall return. Coming up, we're going to talk about, hey, you know it works. Why not jewelry? Diamonds are a girl's best friend. We got all kinds of goodies to talk about. And how about losing a little weight? We'll talk about that. All kinds of good stuff coming up.